has a bunch of questions. Hi.
Hello, how are you?
I'm very well, thank you. How are you?
I am doing great this afternoon. Thank you so much for having me on.
Hey, thank you so much for your time. We can totally imagine that you are full on busy on top of everything that's going on, and you're also obviously creating and putting so much information out there that is so vital in this time. So thank you for coming on Pop Fusion, the talk show, to really share a lot of the confusion that's still surrounding this virus that we're really learning and really just trying to survive and overcome it as best as we can.
Absolutely. I'm happy to be here and happy to try to clear up some of that confusion, because I think even some of us medical professionals are still confused. But I think if we keep talking about it, we'll figure it out.
Absolutely. Well, let's dive right into it. Going into confusions, there is still a lot surrounding it. So what are some of the most confusing parts about the pandemic and this whole process that we've put ourselves into here?
I think one of the things that's most confusing is the different amounts of information and the different types of information that people are getting from their different sources. So the United States is a really big country, right? And so, I'm in Los Angeles County, and we're one of the hotspots right now. So are other parts of Texas, Florida, that's well documented. But there are some other individuals who are in other parts of the country where things are not as much of a hotspot, if you will. The rise in cases is not as fast or as high. And so people in those areas are hearing, well, maybe we can relax, maybe we can do outdoor dining. But then you're hearing nationally something completely different. And then your family members in a different state or different region might be hearing something different. And when you have, the President of the United States, who up until about 20 minutes ago said, don't wear masks, now all of a sudden saying wearing masks, you're getting different information from different sources all over the place. And I think there's just some sort of fundamental things that people can really just dial into and pay attention to those things regardless of where you are.
Yeah, well, it's definitely very confusing when it comes to having different states mandating different orders, and some really relaxing it and trying to, open up as best as we can, because there's been a lot of turmoil economically and emotionally. And as you've just touched upon about President Trump about 20 minutes ago talking about masks, do you think that this whole pandemic has been politicized? And if so, in what way? Is it correct?
Wow. Yeah. It has been politicized. Let's just be honest, right? I'm a little bit of a straight shooter. And so I think it's important to just, call a spade, if you will. Like, this has been politicized. And I think it's really unfortunate because that has come at the cost of people's lives. And I never thought in my lifetime that I would see wearing a mask and doing something that is so simple. I didn't say it wasn't always uncomfortable, but doing something so simple to protect yourself, your loved ones, and your community would actually ever become a blue-red issue, right? A left-right sort of issue. I find it really troubling that that's the case. However, what I do find exciting and sort of also being kind of an optimist is that I think the tide is turning a little bit. I think that those who wanted to make, this a hoax, that COVID-19 is a hoax, and it was put on by, the Democrats trying to make, President Trump's poll numbers look bad, and the president even himself saying, what mask, no mask, all of these different things. Now the data and the facts, which is my world, right? In medicine and nursing, we live in data and facts, and the data is just completely undeniable. Whether you think it's a conspiracy or not, at some point you get to the fact that the data will trump all, pun intended, and eventually Donald Trump will have to say, all right, you're right. The data is so conclusive right now that wearing a mask helps. And, what are we at? Almost 140,000 deaths in the United States, nearly 4 million cases. And the CDC just announced today that they think we are undercounting cases by anywhere to 6 to 24-fold, meaning these cases could be 24 times 4 million could be the actual case number in the United States. I think when you look at all those numbers like that, health experts, politicians, regardless of what side of the aisle they're on, and now, thank God, the President of the United States are finally listening and finally telling people to do what's right.
I mean, it is confusing because I'm going to just touch upon the mask aspect since we are really diving into that. So
Sure.
Back in March, the US General Surgeon, Dr. Jerome Adams, and Dr. Fauci had stated that wearing a mask is unnecessary and dangerous, down to the fact of the way that we wear them, by touching and like putting them on and off and reusing them. And now they're, of course, mandated. What's your stance on that? Why the confusion? Why saying, no, you shouldn't wear them, and now, yes, absolutely? What's been the change in that perspective?
Sure. You use the word change, and that's what I really want to piggyback off of right now, because I think it's really important for people to remember that COVID-19 is a brand new virus, right? It may have been around a little bit earlier, some of the data is saying, but essentially November is when the world really first started hearing about this, and even December and January, when it really exploded onto the global stage. These viruses, just like everything in medicine and health, changes as we learn more about it. So early on, we thought that there was a lot more opportunity to transmit the virus through contact. So if you're touching something and then touching your mouth or nose or eyes, your mucous membranes, you have a higher likelihood to give yourself coronavirus or COVID-19, because we didn't know much about it then. So we had to sort of say, all right, we don't want anybody touching anything, lots of hand sanitizer, right? This is the route of transmission for a lot of viruses, including other coronavirus. Well, as we learned yes, that's a route of transmission, but not nearly as potent as through respiratory particles. So when people do wear masks, and I can attest to this too, I'm this guy, I promise you, even when I have a mask on, at least when I'm out in public, you touch the mask. You want to pull it off, you put it on, you're adjusting it, whatever. Well, if you're constantly touching the outside of your mask, you have to sort of assume that there's COVID-19 on your mask. And then all of a sudden, if you rub your eyes, that could be a route of transmission, right? And yes, that is one. Well, now that as we learned more about the virus, as our knowledge changed about the virus, so did our recommendations, which we started to find out, wow, these respiratory droplets that come out of us when we laugh, cough, talk, like I'm a big talker, right? So like I'm probably spitting all over people when I'm talking without a mask, right? A lot of us are kind of that way. And as we learn even more, we're saying, wow, even some of these smaller air particles might be contributing to transmission, but we can cut the rates of that virus coming out of me or of me breathing it in. We can cut it drastically if you wear a mask. So I don't think it was that, everyone likes to go back to, like you said, particularly early on in March. And even I think into April, it was absolutely do not wear a mask. Some of that was because we learned about different routes of transmission. Some of that was also that we didn't know what the mask situation looked like for healthcare workers in the hospital. So trying really hard to avoid this large influx of patients into the hospital and putting a strain not only on hospital systems and resources, but that PPE. Well, now that we're in a little bit better of a position of PPE, and we know that preventing respiratory transmission is really the #1 way to keep the numbers down, if people can't socially distance, that's why we absolutely have to recommend a mask now. And that's why I think Fauci and Dr. Birx, lots of people, why their minds changed, because it was driven by the data.
Okay. A bit of mixed feelings there, because it's just almost as if the public had been put slightly in danger in the early days. Of course, we didn't really know as much in regards to the virus. Now we know more information of transmission. And of course, it was really to keep, yourselves and so many social worker and healthcare workers safe. In terms of just now that we also know from touching ourselves and stuff, how can we actually then better protect ourselves with the mask? And Gina threw out a question as well about keeping our immune systems up and running. Like, what are the things that we can do to still be healthy as best as possible?
Absolutely. So I love this. I love a two-part question too, because I'm all about prevention, right? So, and both of these have to do with prevention. And I do want to acknowledge, by the way, to your point, I get that this is confusing and really frustrating, because we live in a society right now where I like to use antibiotics, for instance, right? So let's say you have a bladder infection or a kidney infection or something, right? It causes some pain. Maybe you have a little bit of fever. You go into your primary care provider or the emergency department. You get an antibiotic. Almost the next day you feel better, right? 7 days later, that infection is gone, and off you go with your life. You didn't have to stop seeing your friends. You didn't have to stop seeing your family. You didn't have to stop going to the gym, right? This has disrupted our life, and we don't the whole world, us as a human species, we don't have a really clean, concise, exquisite solution to this. But we've all grown up learning that that's how things work, right? I get sick, you give me an antibiotic, I get better, right? We all want that pill to lose weight, right? We all want that magic pill to make my love handles go away because of all the weight I've gained in COVID, right? That's what people want. We don't have that right now as a species. And that's really frustrating because everything on Instagram is instantaneous, right? We call our friends, that's instantaneous. We want to dial up an old movie. We go to Netflix or wherever, it's instantaneous. We are in a now culture. And then all of a sudden you have something that has turned into a global pandemic that has shut down economies, put so many people out of work. Some people are starting to lose their homes now. People have gotten sick and died. 685,000 people died across the world with this. And we don't have that thing to fix it. And so it feels weird when we're like, yep, the way we're going to fix this is for you to put on this mask, which is maybe a little bit uncomfortable, and stay like 6 feet away from your grandma at all times. Like that sort of feels weird, right? Like we would think we could put it, the old saying, we could put a man on the moon, but we can't fix this virus. And there's a lot of truth to that. And I am always someone who I really want to support people who continue to sort of have some concerns about what the science and the data are saying, because I think that that's valid. And those things I just said really are what you can do to stay safe. Remember that this virus doesn't know. I got a question earlier today from a follower who was like, well, my boyfriend tested negative, so is it okay that I assume that I'm negative? Not the case. Have you not been to the grocery store? Have you not gone to work? Have you not gone to the gym? Have you not gone to a restaurant? Any of those other things. The virus doesn't know that your boyfriend's negative and that it's not supposed, you're not supposed to give it to him. The virus doesn't know that that's your grandma and she's sick. The virus just knows that that's another human being in which it could live. So I think we still have to keep our physical distancing. Do your little backyard barbecue. I love it. That's great. Stay 10 feet away from each other and bring your own stuff and wear your masks, right? Wear your masks, hand sanitizer, physical distancing.
Okay. Well, speaking of the entire turmoil that we are going through, so lockdown has been happening for 3 months and we started reopening, a little bit of a glimpse of light there. And now we're kind of going back to square one. Given the economical and emotional impact that this is having on so many people, do you think there's been an overall health benefit towards the process and the impact, like the things that we have been implementing in place? And is there anything that maybe we could have done better? Has it really been worth it to really shut down to the extent that we have had to shut down?
I like to akin this situation to the old ripping off the Band-Aid. So you have a Band-Aid on, and let's say, I don't have any hair on my head, but I do on my legs, right? So if you're pulling a Band-Aid off the hair on your legs and you're pulling it slowly and it's painful and it's painful and ow, ow, ow. And then you just keep going and you just keep pulling this Band-Aid. It's a lot of pain. And then eventually the Band-Aid gets ripped off. That's kind of how this lockdown has been in the United States. The data is very clear. You can tell I like that word today, data, right? The data is very clear. If you look at some parts of Europe, some parts of Asia, New Zealand is a fantastic example. Now, I know that comparing the New Zealand and the United States are very, very different, right? The countries are very different in a lot of ways. But what places that have been able to control the virus and reopen their economies and get us all back to what is kind of a new normal has been that they locked down and they fully locked down. Part of our issue is we never fully locked down. I think you can argue that whatever lockdown we started to have was a little bit late. And I'm not the biggest woulda, coulda, shoulda guy. I like to deal in the reality that we're in right now. The reality that we're in right now is that we had 50 different approaches to what quarantine, to what locking down, to what safer at home was going to look like, because we have 50 different states. And because we didn't have a uniform approach and there was no restrictions of traveling, there wasn't this really federally sort of mandated push to really shut everything down. We never actually got the full benefit from shutting down that we could have. This is just my theory. If we had shut down hard and fast, very aggressively for like 6 weeks, maybe 2 months, we'd all be in a completely different place now. But we're talking about, there are more than 50 hospitals in the state of Florida, accounting for 80% of the population in that state, that are out of ICU beds. California's first lockdown order was March 13th. So fast forward however many months, with 3 months or 4 months, however many months, it says it's actually getting worse now. It's because we've had a piecemeal approach. Some places have shut down, others have stayed open, and others open differently. And yes, restaurants and no restaurants and all of this, yes, daycares and no daycares. I think if we would have really shut down very aggressively early on, and everyone just kind of sucked it up for 6 weeks, ripped that Band-Aid off, back to my original analogy, we wouldn't be perfect, but we'd be in a much better place than we are now. And now what really concerns me is, we're going into the fall. We have to talk about schools. You bring up a couple of times, you've brought up like our mental health, which is so important. It is really, mine included, everyone's mental health is really taking a toll during all of this. I think especially our kiddos, especially parents who are trying to work and teach their kids at home and discipline and tell the kids they can't go play with their friends. And that is a tremendously difficult place to be in. So we have to figure out some way, I think, to get kids back to school, but we also have to let that data drive our decisions. And right now, we just don't know how able kids are to infect adults. We're not as worried about the kids. And, a lot of governors keep saying that. We have to get the kids. The governor of Missouri, I think, just said that earlier today. The kids are going to go back and they're going to get it. And most of them are not going to get sick and it's going to be fine. And he stopped there. It's not the kids that health officials are primarily worried about. It's the kids that live at home in multi-generational families with older adults in the home that have underlying medical conditions who are really susceptible for this. It also, I think, is very important for us to bring up the idea of privilege, and this is a whole other conversation, but Black and brown communities are 4 and 5 times more likely to contract and have to be hospitalized from COVID-19. So when I live in Los Angeles County, right? So that you can talk about people in Westwood and Beverly Hills, and yes, there's more availability to testing and the results come back faster and they can spread schools out and all those kids have computers and Zoom and whatever. But some of our poor communities, which are also happen to be Black and brown communities, their families are at higher risk. More of their families are essential workers. So we're seeing much higher numbers of individuals in those communities. And what I worry about is kids from Black and brown communities going to school, bringing it home to their parents or grandparents who are essential workers who are still out working, and then community spread pops off again.
Okay, that was a lot of information right there. And I'm like trying to digest it all in, because what I'm getting at on the first part that you had answered was that there wasn't a national consensus. Had there been a national consensus, then we might have been in a better place and space now, seeing how other countries have been able to also deal and progress with it. In terms of children, I think there was something interesting I read about Germany, Israel, and there was one more country that had opened up again to kids, and now they've had to shut down again. So there's obviously a concern, though kids do not seem to contract it as much as adults. Is that
kids don't seem to get as sick from it. We're not sure, at least if like there's some sort of natural immunity that maybe kids have to not even developing the disease. Like even if they come in contact with it, they don't develop it. But on the whole, by leaps and bounds, kids do not get as sick from this as adults do. What we don't know is, so let's say we send all the kids to school. That's great. It would be awesome. And all the kids go to school and we get to start learning again, and it's amazing. And maybe some kids get COVID-19. And most kids who get it aren't going to get very sick, or if they do, it's not going to be too bad. What we don't know is how much are they transmitting that to the adults that are around them, the teachers, their parents, their grandparents, other community members. That we just, because the virus is so new, we just don't have a good hold of that information. And like you said, actually, I think the case in Israel was really, really telling. Israel did a great job early on, really shutting this down. They felt comfortable opening back up to kids to school, and now they've had to bring the kids back home because their cases did start to spike.
It is very hard to tell. So we are definitely living in a day-to-day basis. But then do you think it's wise for us to go back on lockdown, even though some states are not? Like, it's just still very much confusing. And then also how they're saying that kids should go back to school instead of September in October. Why the difference? Does it even make a difference within a month?
Very good question. We may have a much better opportunity to get a hold of our testing, which is really the big key. So right now, you know, the NBA bubbles going on, right? Those guys are getting tested all the time. The WNBA, they're getting tested. The MLS, all of these, you know, the athletes are getting tested. Donald Trump says, you know, well, his press secretary, he said he gets tested multiple times a day. He said he gets tested 2 or 3 times a week. Either way, tests are plentiful for those individuals who need them. Where tests are not plentiful right now are in communities with like public schools. So in a perfect world, we could test kiddos every morning when they got to school, and we could test the teachers, and everyone who's negative gets to stay and school goes on as normal. And if you're positive or it's an indeterminate test, you go home and quarantine until you get a negative test. In a textbook perfect world, that's exactly how this would happen. Well, we are still ramping up testing very, very, very aggressively. We also, even just a month, even just 4 weeks, gives us an opportunity to not only continue to ramp up testing, figure out what testing could look like, but then also give teachers, administrators, school districts times to figure out what situation might work. A lot of them are talking about having kids on an A week and then a B week. Some are saying half day, some are saying only 10 kids per classroom, or whatever is going to work for that school district. Right now, you know, I think they're having to operate on, oh my gosh, it's, you know, the end of July and I don't know what to do. My kids are supposed to start school in 3 weeks. We need more time to figure out what this is. And I think a month could change some things. I think ultimately, until we get a vaccine, it's still going to be this piecemeal that you're talking about. This some are open, some are closed, and that's really unfortunate.
Okay. Well, speaking upon vaccine, there has been some very recent news. What can you share with us about the vaccine that they're trialing right now?
So I feel like this is one of those places for optimism, right? There's so much that we talk about with this virus that is kind of sad and upsetting sometimes, but the vaccine to me is very, 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 I'm cautiously optimistic, I should say. I'm a pretty optimistic kind of guy, so I should be kind of cautious about this. But, you know, there's multiple individuals working on vaccines. We hear most about Moderna, which is a US-based company, and they received the largest portion of funds from the President Trump's coronavirus task force. They initiated Project Warp Speed, right? That was what he called it earlier. They're going to warp speed into a vaccine. And Moderna's vaccine, it seems to be going well, and it is going very, very quickly. But the vaccine that the world seems to be the most excited about right now is the one coming out of Oxford, and it's in partnership with AstraZeneca. And part of the reason they're a little bit further ahead is because the vaccine researchers at Oxford were already working on a bunch of coronavirus vaccines. Because remember, coronavirus is a family, right? And COVID-19 is that step cousin that did nobody invite to the barbecue, right?
And there's like 6,000 of them or something.
Yeah, there's all these different coronaviruses.
There's so many of them. There's so many we can still be scared of. So this is like a very big teaching curve and lesson.
Absolutely. Well, and a lot of coronaviruses have been around for a long time. And there's some that have been more deadly, right? Like MERS, Middle East Respiratory Syndrome, or SARS, acute respiratory system. So syndrome, excuse me. So COVID-19 is one of those. Well, the team at Oxford were already working on vaccines against sort of the family of coronaviruses. So they were kind of ahead of everybody else in the game. So where they've been able to move into now is a phase of human clinical trials where they've been giving the vaccine to individuals and then monitoring them for 3 things. One is an antibody response. So we kind of know about antibodies, right? There are immediate fighters where our body like learns how to fight off a virus right away, right? Or an invader. Then there's our T cells, which is another part of our immune system, which is sort of it's like medium term, you know, so we have short term, medium term, long term defense. And T cells are sort of our medium to long term defense against viruses like COVID-19. And then the third thing they were looking at were the side effect profile. So did people get nauseous from this, headaches? Did they have rashes or reactions to it, which is the most common, reactions to vaccines? So what they found from those 3 things is that this vaccine that they're working on had a great antibody response. Most people mounted a really robust antibody response and a really robust T cell response. which is great because what we're seeing is that in antibodies, they're not lasting very long. So the people who get sick with COVID-19, we test them for antibodies, they have them. But even as fast as 6 weeks later, we were not detecting antibodies. Well, in this so we got to have a vaccine that does both antibodies and the T cells, right? Well, it was a big antibody response, a big T cell response, and very, very, very low side effects. Not very many side effects at all. So tremendously exciting. The caution, though, is that this was in not a lot of people.
I was just going to ask you why you're like cautiously optimistic.
Cautiously
really
optimistic
right now.
Yeah, I am. This is by far the most optimistic I think that anyone has been about a potential vaccine. What we have to be careful of is that you can never take a small group of humans and extrapolate that to the whole world, right? So you can, never, I'm trying to think of a good analogy here, but you can't drive a Honda Accord and then say that that's exactly what driving all cars are like. Well, no, if you've never driven a Ferrari, you don't know what driving a Ferrari is like, right? So you can't take a small set of human beings and say, well, this worked in a really small set of human beings. It's going to work in everybody. So you have to get trials progressively larger, a progressively more diverse group of individuals, right? Because people with different health conditions of different ages, those types of things, different, even cultural backgrounds, the way people eat can really influence medications. So you have to really be careful about testing the right subset of individuals to get to a place where you can be pretty darn confident that this is going to work in the larger set of humanity.
So I would imagine if you do trial it on a small set of group of people, and as you're saying, you would want to try many different types of people, different backgrounds. It almost sounds like you'd have to test an entire city like LA that has so many different parts, so many different backgrounds, so many different types of people and ways of lives. Would that be the next stage?
In a perfect world, we would test that many people. Yeah, I don't think that anyone's going to be that patient. I think we need this vaccine, faster than that. You're right, exactly, right.
We Amazon delivery right now, vaccine.
Correct, right. I want it prime. I want it within 2 hours. So there are, you're right though. Essentially what you're doing is you have to get a certain diverse group of individuals. Randomized control trials are the perfect way to look at this. So what you do is you give a certain group of people a placebo, another group of people the vaccine, and you compare those groups to each other to see what the reactions are, things like that. So we do vaccines very, very well as a species. And I'm talking quite literally about all of us in humanity. We smallpox and measles and all of those different things. Even hepatitis now. We do vaccines very, very well. So we're pretty good at figuring out how people are going to react to them in terms of a side effect profile. What we just can't know for sure until we start testing on more people is how big of a response the antibodies and T cells are going to be. And then most importantly, how long are those T cells going to last? Is this going to be a vaccine that we need to turn into something that's yearly like the flu, or do you get it once and you're good for life? We don't know yet.
Well, it honestly sounds like we still have a process ahead of us. Hopefully we are making some progress. I'm sure the rest of the audience, we could all just ask you a bunch of questions and we'd love to keep you on board more, but we have to let you go. But before that, if there were any questions that anybody had, you have a really great platform. So please do share before we let you go, your platform, what it is that you share on there and what people can ask you as well.
Sure. And just also, thank you so much for having me on. I really appreciate this. And I love your questions were great, by the way. I love that you're asking all the things that everyone wants to know, right?
Yes, we hope that's clarified some information
Absolutely.
for you guys.
It's very much so.
We need experts like you to share this information.
I'm trying. I'm trying. And if you have questions, you can always ask me. My platform is Ask the NP, everything you're too scared to ask your MD. So I deal with a lot of before it was a lot of embarrassing sex questions and things like that. I'm always happy to talk about that. But as you can imagine, the last few months, it's been a lot of COVID. But whatever your questions are, my DMs are open. You can hit me up in the comments. And again, thank you so much for having me here. I really appreciate it.
Amazing. Well, thank you so much, Dr. James Simmons. It's been such a pleasure talking to you and getting some clarification there. I hope you stay safe, be well, strong, healthy. And we'll be following up with you on your platform, Ask the NP. Thank you so much again.
Thank you.
And thanks, guys. We'll be putting that on Pop Fusion, the talk show. So stay tuned for more information and pop culture news as well. Bye, everybody.